Well, welcome everyone. Dr. Rob Kiltz, Carnivore Conversations, and I'm really grateful that Dr. Tony Hampton has joined us today to talk about his experience in healthcare and how he is a driving force in improving everyone's health and wellness. Dr. Hampton, thank you so much for being here. Tell us a little bit about yourself, would you please?
I would. And thank you again for also joining me for my podcast. I really appreciate that. And the more we get the message that the animal-based diet is important and should be an option is going to be very key. I'm shocked there's not more people yelling and screaming that, but thank you so much for that. And, I'm a family doctor. I help folk with obesity and chronic diseases in the Chicagoland area. I was actually raised by a single mom. I have an older brother. We all lived on the west side of Chicago. They called it the tough side of the city, but once you're there and you're living it, you don't know any of that stuff. And but what really helped me, interesting enough, Doc, was when we moved from the heart of the west side to closer to a suburb called Oak Park, and literally right across the street from me was this tennis court, and the tennis court was important because it allowed me to see the world through a different lens. And while others in my community would kind of go further west back into the heart of the city, I was going kind of into Oak Park to find people to play tennis with. And then I noticed that it wasn't just that they had more resources, but it was this idea that they thought differently. Their parents taught them different values. And I always thought that when you had things, somebody handed it to you. And then I learned quickly that that's not it at all, that people who have things, for the most part, earn it. They work hard, and there's no sense of privilege. So I think for me, growing up in the city on the west side, I had to tell the two cities, one where people maybe struggle. Then I had this nice suburb right next to it. And I saw both worlds, which made me comfortable in both worlds as well. So having that balance and being able to see the world through two lenses helped to shape the man I am today.
Well, tell us a little bit about what the deciding point was to go into medicine and journey into healthcare.
Yeah, becoming a doctor is a very interesting, thing that a lot of parents want their kids to do, right? But for me, there's a high school in the city called Lane Tech High School where I went. And that high school was really known for, architectural programs. And so when I went there, I thought that was my destiny. Later found out that drafting boards and things like that wasn't really, who I was. It just wasn't. And interesting enough, about 10 years ago, they stopped that program at Lane Tech in lieu of people not being as interested. And I think they lost some of their really experienced teachers. So during the second half of my high school, I had to start thinking, what am I going to do? And I knew I wanted to be helpful to people. So I started thinking about things like, maybe being a tennis instructor since I was a tennis player. I thought about being a teacher. But then when you come from a single parent home with limited resources, it's my goal was to be able to one day help my mom, right? So I said, I got to do something that's going to put me in a better position. So I thought about attorney and a doctor. And when I thought about the attorney, it's kind of funny. I thought about, am I a Perry Mason type? Am I going to be able to get in front of people and, debate their cases? And I just never thought that was me. Although ironically, I think I can do it now. And so that left me with the doctor thing. And I ended up wanting to do that because I could help people. My mom would tell you that when I was probably around 11 or so, I fell, I cut my hand. I still have the little scar in the middle of my hand right here. And when I went to get that looked at Cook County Hospital, she said that this is something that I said to her at the time, I don't feel anything. I would love to be able to help people not feel pain. So that was kind of like what my mom tells me. And that's what got me into medicine. And when I started my journey, it was most of the traditional, let's diagnose things and, give people the right medicine. I know Ozempic's been in the news lately, and I thought, that's what I'm going to do. And then later, because, I had kids, I have two boys, they're now in their 20s. And I started my journey with diet and into my practice, trying to make my kids healthy, right? So I remember getting this book, How to Disease Proof Your Kids, by Dr. Joe Furman. And once you go down the plant-based path, you kind of get looped into that. So I did that with my family for about 8 years. But then my wife developed type 1 diabetes. And when she developed that, she was not very happy. She's a pharmacist. And I kind of made a decision at that point, you know what? Let me figure out how I can use lifestyle to help her. And that's when I discovered that, okay, you have a carb problem. Maybe you should restrict the carbs. So that kind of led me down the low carb path. And then that later turned into keto, and then more recently into carnivore. So we're kind of ketovores in this house and carnivores. And it's really been awesome for my patients because they have really benefited from this approach. When I was kind of encouraging vegetarian lifestyles, they did okay with that, but I couldn't get that, adherence to that. And I found that I really wasn't taking people off medicine. When I started low carb and keto, and for some carnivore, it's been like magical. So for me, that healing spirit of being a doctor was renewed once I understood that food is medicine. So it's been like a joy to go to work every day.
So in medical school and residency, you learned, likely like myself, not much about nutrition, or at least not the way we're learning it today. And did you ever feel a sense that what you were telling your patients was actually contributing to their sickness?
I didn't. I honestly was so convinced that if I just follow the guidelines, my patients would do better. And I think I got caught up in this illusion that my patients simply weren't doing the things I recommended. I did feel better, for example, when I went from the standard American diet to more of a plant-based diet. What I discovered as I was trying to help my patients was that although I got a few people to kind of agree that maybe a clean plant-based approach was helpful, what I found is that they still struggled to follow that dietary pattern. It was just such a culture shock for them. So, and then I noticed for myself personally, although I felt better than the standard American diet eating this way, because of the plants, which caused a lot of gas, a lot of bloating. And I just convinced myself that if the experts say that you need the phytonutrients and you need the antioxidants, and even if the Brussels sprouts cause harm in your belly, you'll get used to it. Just take some Beano. And what I realized is that no matter how much Beano I took, it wasn't enough.
Yeah.
I would always feel bad. And then again, then I discovered there was another way. And sometimes we get into the matrix, I call it. Like if I start with Dr. Joe Furman and that's what I see, we get caught up in the matrix and we can't see anything else. And I would say the same is true for carnivore. Everybody should be open to new information. They should always be critical of what they're learning, and they should always second guess everything, trust but verify. And that way, none of us get indoctrinated into a way of thinking that may not serve us tomorrow, even if it's serving us today. There's always a better way. I never knew I needed. I got LASIK now, but I used to wear contacts, right? And so when I was wearing, before I had glasses like on your face right now, I didn't know that I couldn't see very well. I remember the first day the eye doctor put some glasses in my eyes, and it didn't just get clearer, everything got brighter. And so for me, I think a lot of times we don't even know when we don't know something or haven't. So for me, be open to questioning what you believe. And if you keep doing that, you'll fine tune things. And that's kind of what Carnivore did for me. It allowed me to kind of do an experiment. And I just, so when, and what I've learned now is that when I eat animals, I feel nothing in my belly. And when I eat plants, most of them don't make me feel that way. So for me, I try to do the animal-based approach as much as possible. I'm not expecting my patients to go that far. I just tell them, let's do an elimination diet. And if you can tolerate some green beans or greens, that's fine. But if your body says no to that, then listen to your body.
Well, so where'd you go to medical school?
I went to Chicago Medical School, which is like in like North Chicago near a suburb called Lake Forest. And it's actually where a lot of the basketball players for the Chicago Bulls used to kind of live in that area. Mr. T used to live in that area. So I would always see him drive by in his Rolls Royce convertible. And it was a very, very ritzy neighborhood. But that's where I went to medical school. I did my residency in family practice at a place called West Suburban, which is not but blocks away from where I grew up, which is kind of cool. So it was this really good family practice training program. I did maternal child health fellowship, which is a family doctor who then learns to do C-sections, tubals, and D&C. So it's getting into your world a little bit. And then I worked as a family doctor who did those things for about 10 years. I later transitioned to my large health system advocate, Aurora Health. And now I have more of an adult population. And in that adult population, I pretty much take care of those chronic conditions. I do miss the baby business. I'm sure you do as well. But I found that was a nice sweet spot for me because the number of people you can impact is just beyond words. I mean, so many people have given up hope. So by the time they see me and they're like, hey, we hear that you can help us get off medicine, they're just not hearing that from other clinicians. And again, it's the training. We don't talk about deprescribing when we're training. We talk about, maximizing the dose of the medicine so it'll be effective. Docs are not looking at the studies that deal with nutrition as much as they're looking at the studies that deal with med. So I think it's a paradigm shift that we need to get more clinicians to value. And I think once they understand that it works and it's really effective, I think they'll be more likely to engage in that conversation.
So what was the turning point for you to focus? Because I see you're an obesity specialist and you've written a book on Fix Your Diet, Fix Your Diabetes. And maybe you can tell us a little bit more of those two things. How got you into diabetes and what got you to writing that great book?
Well, the book, I mean, you have 15 minutes, right? So when you have a 15-minute appointment, you need to be able to have a resource. So my intent was to simply have a resource to answer a lot of the questions and provide guidance for my patients. I also have a link tree that I use that'll then point them to the handout. And I made a video how to do low carb. So you have to make it quick, easy, and something they can digest. But the main thing that helped me shift my focus is really about, I have an MBA, right? So I said, well, what's the return on investment if I do a certain approach as a doctor? And what I found is, if I spend a lot of energy and time on what yields the most results as a doctor, that makes sense. So I learned about this idea of, what makes people sick. And that, of course, leads to insulin resistance. And that, of course, I call myself, me and my wife, I'm the metabolic health doc. We call ourselves the metabolic health couple because we realize that if we help people achieve metabolic health, that'll deal with their risk for heart attack and stroke and dementia and cancer. And if we can do that, we'll get, we'll hit like 70% of the medical conditions. So for me, it was shifting to that way of thinking. The book is a resource and helping people understand that and making time. So when we have these very brief appointments, we use that time not just to refill medicines and to make sure they're getting their eye exams and things like that. We talk about nutrition every visit. If they come in and they're like, Doc, I just got shot. And I'm like, okay, great. Let's deal with the gunshot. But by the way, if you want to heal well, we need to talk about nutrition. I talk about nutrition no matter what they come in for. And another example of how all of this stuff is the same, like for the blood pressure, most of my patients, when they first see me, they say, well, I'm trying to restrict salt, doc. And I say, okay, that's great. Salt's part of the picture, but they've never heard of hyperinsulinemia. They've never heard that too much insulin leads to reabsorption of sodium in the kidneys, which then leads to hypertension and heart disease. They haven't heard those terms. They've never heard that insulin resistance can then lead to less production of nitric oxide. They may have heard of nitroglycerin that you take when you're having chest pain, but they didn't know that their arteries made this already. And the reason why it's not making it is because they became insulin resistant because of too much insulin, because of the food they're eating. So once they connect the dots, and I try to do that for them, and then I I speak to their heart and say, man, if you could move towards a model where you don't have to take medicine and instead you just eat the right way, would you be interested in that? And are there things you'd be willing to sacrifice to achieve that? So that's kind of the approach I take. And I think a lot of patients that resonates with them, because to be honest with you, they're not used to hearing doctors talk about not taking medicine. So even if a person comes to me and we think about hyperinsulinemia, we think about diabetes, right? So if they come to me and they're new to me and their A1C is 7 or 7.5, I'm the kind of doctor that I'm not, I'll say, here's the paths you can take. We can take the paths of medicine, or we can take the path of root cause of why you have a high glucose and avoid that toxin, which is, too much glucose. And most of them will say, you know what, I'll pass on the metformin. And that may be an issue in a conventional health system where it's anticipated that you're going to give those things, right? I said, let's try that. Let's not become a human pincushion. Let's try. And what happens is most people are willing to do that. And it's such a nice way to like begin a relationship with patients, saying, I believe in you. I think you can do this. And let me give you the information that'll help you get there. So for me, it's been a slam dunk. And I just, again, my passion is to make sure at least people have heard this information, and what they do with it, I have no control, but I just want to make sure we get the message out. And that's why my clinical practice has been so much more fun.
I've always noticed in medicine where we often will look down the list of their problems, their blood pressure, their laboratory results, and we will kind of sort of negatively approach this. Well, this isn't looking good. You're doing a terrible job. What are you doing? You shouldn't be doing this or that. Versus how you doing? You look great. What can I do to help you today? And what is your thoughts on sort of we're chastising them for the negativity, but we're not being the coach and cheerleader? Because it sounds like you're really working on the coach and cheerleader part to motivate people. Can you talk a little bit about that, Dr. Hampton?
Yeah, I think that what my colleagues were not taught in school as much as they should have been is the importance of building rapport with people and helping them to understand that they've been successful in a lot of ways in their life, which is going to then give them the foundation to be successful with any challenge they face. I've always believed that whether we're dealing with a job situation, I'm a medical director, or how we raise our kids, we all have gifts, right? So if I have 10 things that my team needs to achieve to, achieve our quality metrics, right? We call it PHI, Population Health Index. If my team achieves 8 of those 10 things, right? I should be celebrating, because that's a pretty good test grade, 80%, right? But what most organizations do, most leaders do, is they say, that was great, but that's that but, B-U-T and capital. And then they focus on the 2 things you didn't achieve. And I just think that that's not a good way to motivate people. Now, one of the things good about education is that a lot of times you will learn motivational interviewing principles. And so when I meet somebody, what I say to them, if they say they're eating the wrong things for breakfast, I'll just ask an open-ended question. So what are you eating for breakfast, right? And then I'll say to them, okay, sounds like you're eating bacon, sausage, oatmeal, and a banana. You may not know that the banana and the oatmeal are going to raise your sugar, but I think you're doing great because that's exactly what I ate. So I frame it from making it personal, and then I say, but would you be willing to focus on the bacon, sausage, and eggs instead? So they look at you funny, but that's what I say. But I do an open-ended question, and I keep it positive and saying, you know what, you're doing a great job. We're gonna tweak it just a little bit, and then I'll see if they're I try to build up their confidence. I give them some hope, saying what's going to happen if they do these things that you have done really well, even in a dietary perspective, even in terms of what they've done to lose weight. So I try to paint a picture of what life can look like. And a lot of times patients really appreciate that. And then I look at the person in front of me, and once I kind of know who they are and how motivated they are, then I start to throw all those resources at them, like my link tree and my handout, and any how to do low carb video on YouTube. And if they really sound like a person, sometimes I'll fill out Dr. Joan Iflin's her questionnaire that talks about processed food addiction. And if they answer a lot of yeses, I'll say, well, we may have to invest in that. So what I do is I make sure they have resources like your YouTube channel, Dr. Kim Berry, and others, and make sure that they are able to understand that the problem has never been them. That most of the problem has been the information. And even when I think about it, me as a health leader, one of the things I learned a long time ago, that when things are broken, and I think it's called dimming, but but he talks about like 93% of things that are not working well are not the people, it's the process. And I think the process that we've been teaching people on how to lose weight and how to achieve health has been wrong. So we can't blame the people. We have to be honest with ourselves, look in the mirror and say, you know what? We didn't quite get that right. And maybe there's another way. And it's not the only way, but there's another way. And then we give people grace and say, hey, let's do an experiment. If this doesn't work, we'll try a different approach. And what I found is that when people are motivated and they're out of their their crazy life, because life gets crazy, then they're able to achieve their goals.
So you live in you work in a large healthcare system as a leader there. How is it to implement this story of keto and carnivore in a system that typically didn't offer these ideas?
Yeah, it's not as hard as it appears. I do have to justify my recommendations in a way that if I say a person doesn't need to be on a statin, I need to. So I may put a comment in a note based on a recommendation that's out there. You have a 0 calcium score, for example. If you have a 0 calcium score, the American Heart Association says even for a diabetic, they don't have to be on a statin. Now that's contrary to every recommendation that may not be standard of care in the health system, but if I have a patient in front of me, that's so part of it is to frame the discussion around science. The other part is that I am fortunate with Advocate Aurora Health to be in a health system that allows us, even though we're a medical group and we're a large health system, they do allow us to have an individual practice model. So it's not likely that one day I'll get a call saying, you can't have a YouTube channel, you can't talk about that. You're not and I'll be honest, one of the reasons why I got a master's in nutrition is to be able to say to people in front of me, I'm board certified in obesity medicine. I have a master's in nutrition, so I should be allowed to talk about nutrition. So you have to play this game.
Yeah.
But at the end of the day, I have not had a lot of pushback. And I think part of that is because the results don't lie. And if you have a clinician who's working in a health system who's taking people off medicine, then why would you then penalize that clinician, even if the rest of the system is not thinking the same way? So I just think you have to have a little courage. And then what I try to do and what I've done in the past, we do have programs. Since I'm on the south side of Chicago, there's probably the greatest need for this information. We know a lot of people of color have poor metabolic health for many reasons. So because of my excitement about this, I've been able to lead our healthy living program, which allowed me to get in front of large crowds of our patients, maybe anywhere from 100 to 200. Right before the pandemic, we did this fairly often. We have, of course, diabetes prevention programs and COPD programs for bronchitis and emphysema. And we focus on nutrition and other lifestyle approaches with that. We also have a food pharmacy where we give out food. Of course, we tweaked it because the Chicago Food Depository, we had to tweak it so it's low carb friendly. But we do that at a few of our hospitals. And now we're going to be doing a smart farm So we actually have land that we had leased out to others, and now we're bringing that land back in, and we're going to grow some of the food that we are going to be giving at our food pharmacy, which will then allow us to have more food than even we got from the Chicago Food Depository. So it's really just having clinicians with a passion to help lead those kind of programs, letting our patients know that this type of approach actually is important because we're emphasizing it. The thing that we're working on now is, let's bring some coaching to the, because we know a lot of the success or failure is based on not having that support. And I really want to do what Dr. Tro did, which is let's see if we can reduce the cost of care for our employees by introducing low carb to them, and reduce the cost of care. Maybe get some folks off medicine, reduce the expenses, particularly for those patients that we're responsible for their care. So those are kind of like the visions moving forward. I also am the medical director for Food Smart. Food Smart's kind of an app that provides directly kind of a coach / nutrition person who's flexible enough to help somebody who's a vegan and somebody who's more animal based. So I think we want to be flexible. We don't want to, although I have a passion about animal based diet, we want to meet people where they are, let them do their own experiment. And then if that experiment leads them back to where we think they should be, that'll be great. We just want to remove that fear that animal based diets is harmful.
In your experience, the social cultural norms within the communities, how do you help sort of unfold these ideas? Because diabetes and hypertension and many of these diseases are quite common, I'm sure, in the communities you're taking care of. How do you help sort of share either a completely different dietary lifestyle, or how do you modify it to fit in the cultural lifestyle people are in?
Yeah, well, I think you have to. For me, it's about bite-sized pieces. And I'll be honest, I think one of the reasons why I've been more successful with a low carb to carnivore approach versus plant-based is because it's much easier to say you can still eat the ribs. Would you be willing to use a keto or low carb rub on the ribs? And by the way, saturated fat is not associated with heart disease. And I literally pull up the Journal of the College of Cardiology position statement so they'll see it and they won't think I'm just some quack, right? That's just, in the twilight zone. So part of it is, I think with the right information in front of people, they're more likely to consider things that they hadn't considered. I stay in their lane. Now, I am fortunate to be in a community where I kind of have a sense of what they enjoy. So if I say something like, I know mac and cheese is a popular item, right? So if I say, well, they got this cauliflower mac and cheese, would you be willing to experiment? And I may have to say to them that the pasta and the cauliflower doesn't have a taste. And believe it or not, the taste comes from maybe the heavy cream, butter, cheese, and things of that nature. So what I do is I try to give them a vision of what this change would look like. And most people, believe it or not, as long as you don't take them too far from their comfort zone, are willing to accept it. Thankfully, animal-based foods are highly desired by a lot of people. They just thought it was harmful. So when you kind of focus in that direction, particularly with the guys, they're just like so excited when you say ribeye, right? They feel like a sense. I literally talked to a good friend who was visiting from the South, and as I sat down with him and he was literally grabbing his wife. Listen to Dr. Hampton. I told you the steak was okay. So we have, and in communities of color, let's be clear, because of Dr. Sabi and others on YouTube, the message out there is that you have to become plant-based. So I'm constantly fighting this idea that you have to be plant-based to be healthy. And what I'll do in a clinical setting, I'll say, did you know that the folk in Hong Kong eat 2 steaks per person on average per day, and they live just as long or longer than the folk in Japan, which is the so-called blue zone example. They've never heard that. Did you know that the Mormons eat a lot of meat and they live just as long as the Seventh-day Adventists? who eat plants. They've never heard that. So the first thing I tell them is, it's not necessarily about the plant or the meat necessarily. It's about eating real food. But to say that meat is bad for you is a crazy thing to say, particularly when you start to break down what's essential, which is the protein and fat and not the carbs. So I think they just need very simple examples of a rational reason to do this. Keep it culturally relevant. I do have some women that don't want to lose too much weight because in certain communities, you don't want to be skinny. It is what it is. And we talk about how can you achieve your goal and still have a body. And when I'll tell a Black woman, for example, I'm not sure you need to have a BMI of 25. I mean, I'll measure their wrist and I'll say, you know what, I learned in obesity school that, you're allowed to be a little bit, heavier. But if your metrics, if the things we measure are okay, if we measure your C-reactive protein and your SED rate and your apolipoprotein being all these metabolic things that we measure, and they look good, and you have a calcium score of 0, and then you know what? The things that you've worried about were probably overrated. So I think they need science to support what we talk about. They need a person that talks to them with dignity and respect, who's not pointing the finger at them. And being in a community that I'm comfortable with has helped that to be a lot easier. Although I will admit, some of our best doctors are not from that community. So the key is to just meet people where they are, be respectful, empathetic, give them grace, and then give them bite-sized pieces to change.